Hello, I'm Richard Taylor, and I've got 4 possible projects to mention, which reflect some of my activities, which is in international health and also in non-communicable disease control, and also I've been involved in cancer screening. They are active research projects, funded research projects at the moment. And this is in no particular, by the way, none of these projects require ethics approval. None of these projects require collection of data. The data are there, right? And you've just got to go and scoop it up, or in terms of literature, you've got to go and search the literature. So, I've got a problem here with tangling. This is one of the problems with handling microphones, you know. Right. Okay, so 1, trends in Bangladesh mortality and life expectancy over past decades. Now, this just comes from the fact that there have been analyses about changes in particularly improvements in mortality in Bangladesh, and there are also discussion about the validity of some of the data which are being used, so this is to actually do a review of the data sources. And the reason why this came about was because I have a colleague who's been doing consultancy work in Bangladesh with the statistics people, and who met a previous student of mine over there who's involved in handling some of the statistics, and I've already got some, this is unpublished, data on mortality in Bangladesh. So if anybody's interested in that. Are there any Bangladeshis here? Huh? No? Well, I was going to press gang Buzzid into it, by the way, if we get something going, but I thought somebody might be interested in that. Okay, that's 1. 2, this is chronic obstructive pulmonary disease, trends in mortality in Australia and also in the US, and this is because I've got professional contacts with a respiratory epidemiologist in the US who's very interested in this, and suggested to me, you know, that we ought to compare what the trends have been in decline in chronic obstructive pulmonary disease mortality over the last 30 years in the 2 countries. And of course there are complexities in how you actually define chronic obstructive pulmonary disease from death certificates, because it's not easy. You know, it can be chronic bronchitis or asthma or emphysema or, you know, whatever. So that is something else. That's the second one. Of course, all of these could be associated with publications. Then 3 is a critical review of service studies of population mammography screening in relation to effects on breast cancer mortality. And this is because I'm involved in this at the moment, and we're doing an analysis of mortality effects of population screening in not in Australia but in a neighbouring country, so although randomised trials have demonstrated effectiveness, there's still a lot of controversy around mammographic screening, as you've probably seen if you read, you know, the newspapers. And so there's already been a lot of work. There's already been work done on looking at looking at established service screening programs and their evaluation of their effect. But I think the last main summary paper was 2006, which is almost 10 years ago now, and so there's we can update that. We've so that there is previous published data on it. Secondly, we have my group has collected information on various evaluations of service studies over the last 5 or 10 years, and it needs to be classified by methodology. This is if you're interested in epidemiological methodology, there's a lot of that in it, you know, to try and work out what kind of methodology they've used to evaluate the service study. That's the, and also then perhaps doing some sort of crude meta-analysis is better than, well, not doing a weighted meta-analysis, but actually deriving some summary statistics from all of these studies together, you know, like the median and whatever, but to summarize the data. What we've done so far shows that it looks very much like what you get from the randomized trials, but this is not going to convince, it hasn't convinced the detractors. Fourth and last is, this would suit medical doctors. Are there any medical doctors here? Right? This would suit medical doctors because it requires some understanding of clinico-pathological processes. And it has to do with analysis of diabetes type 2 mortality and how these are classified and how they're coded internationally, and how using ICD, International Classification of Diseases, Systems 9 and 10, which there's been changes in how these are coded and the effects of this on producing diabetes as an underlying cause of death. And how this relates to our clinico-pathological understanding, because I don't think that one can regard disease coding as purely a coding issue. You know, it also has to relate to our understanding of the disease. You know, review this. There is a scientific literature in this in this area. There's a global burden of disease. What do they actually do? It's often not easy to go through those, you know, 10,000 pages to find out exactly what their methodology is in many instances. And we have got, as part of the research we're doing on NCD control in the Pacific, we've got reasonable size unit record collections of death certificates and things like that. So there's plenty of data there to actually use for illustrative purposes or to analyze, you know, from publications. You know, and you can show that you can almost get the proportion of deaths due to diabetes that you want, depending on how you use the coding classification. I mean, this is the problem. So anybody interested in that, and it's been handed around, just come and see me.